While the whole world is in a panic right now, I want to show you something that will set things in perspective. This is coming straight from the peer-reviewed The New England Journal of Medicine. COVID-19, Navigating the Uncharted. Look, as you can see in this editorial, they're actually saying that if you include all the folks who are asymptomatic and minimally symptomatic, that it would actually bring the fatality rate considerably less than 1%. It's actually comparable to a severe seasonal influenza or even a pandemic influenza. And the fatality rate for influenza is approximately 0.1%. So this in and of itself shows that this entire response of all the shutdowns, the shelter-in-place orders, the lockdowns, is way highly overblown, and the numbers are exponentially inflated right now. Now, I want to show you something from John Rappaport on the Eastern Spectator. Here's what the CDC says about the test for the coronavirus. He's actually citing a CDC document. So let's just go ahead and pull it up. On the CDC website, Coronavirus Disease 2019, Information for Laboratories. Scroll down and click on CDC 2019 NCOV Real-Time RT-PCR Diagnostic Panel Instructions. The test being used around the world, called the PCR, tells patients, yes, you have the virus, no, you don't. The document establishes guidelines for how the test should be done and what the results mean. And here's the paragraph from the top of the document, right underneath where the table of contents are. Positive test results are indicative of active infection with 2019 NCOV, but do not rule out bacterial infection or co-infection with other viruses. Wow. The agent detected may not be the definite cause of disease. What? Laboratories within the United States and its territories are required to report all positive results to the appropriate public health authorities. So the key phrase in the paragraph, the agent detected the coronavirus may not be the definite cause of disease. So John raises some key points here, basically saying that obviously the CDC admits that the test could actually show that the virus is present in someone's body without actually causing disease. So in other words, they're admitting that it could be showing false positives. So obviously, anytime a virus invades our body, our immune system fights it with white blood cells that are in our bloodstream, of course, to kill it. And I think one good question that John raises here is, at what point does a virus need to be replicating itself in our body to actually cause illness? Basically, it would have to be replicating millions and millions in order to actually cause illness in our body. Of course, the PCR test fails to accurately judge that, of course. But like I said, regardless, the CDC is ordering labs to report positive test results to public health agencies, where they are added to the numbers that are being flashed before our eyes on the TV screens. Now let's move over to the Federalist. Inaccurate virus models are panicking officials into ill-advised lockdowns. Obviously, we see with the lockdowns all over the country, we have these governors that are giving daily press briefings, COVID-19 updates, how they're handling matters in their jurisdictions, of course. They're all pointing to this overly exaggerated data from the same source, an online mapping tool called COVID Act Now. The website says it is built to enable political leaders to quickly make decisions in their coronavirus response, informed by best available data and modeling. They give a state-by-state forecast, just like a prediction model, of course, designed to help officials flatten the curve before they reach a point of no return, as far as healthcare systems and hospitals being overrun and so on and so forth. But like I said, just as some examples of their highly exaggerated forecast models in New York, COVID Act now claimed that nearly 5,400 New Yorkers would have been hospitalized by March 19th. It turned out there was only 750. They also claimed nearly 13,000 would be hospitalized by March 23rd. The actual number was around 2,500. In Georgia, they forecasted 688 hospitalizations by March 23rd. There was actually fewer than 300. They predicted Tennessee by March 19th, 190 hospitalizations. Turned out there was only 15. So like I said, this is going on a state-by-state basis with the highly exaggerated modeling forecast. Obviously, we have the media, the newspapers, television news stations pointing to data coming from the same COVID Act Now modeling forecasting data. Like I said, you have folks all everywhere. They're posting this stuff on social media. So these numbers that are being flashed before our eyes, as far as all these predictions and forecasts, they're predicting over 200,000 deaths right now, as far as in the United States, as far as that goes. So, like I said, they're just hyperinflating everything going on right now. That's why you have all the. We're all basically under medical martial law right now, with all these shelters in place, quarantines, and so on and so forth. So like I said, we have peer-reviewed medical journals basically saying that this whole entire pandemic with the COVID-19 is actually more comparable, looking at the numbers, to a severe influenza outbreak, okay? We have the CDC's own document basically admitting that many of these PCR tests are actually coming back as false positives, all right? We have all these predictive modeling forecasts that the governors, other officials around the country are using. Of course, they're all highly exaggerated, all right? I'm just using remember, if they're official numbers, so they can't be questioned, right? They're official. So, there you have it. So, like I said, if things aren't really as bad as what they're purporting it to be if all these numbers are flashing before our eyes on the TV screen, then why all the big fuss? You have people going around, film your hospitals. They're going around illustrating how the hospitals are pretty much ghost towns right now. They built all these tent hospitals everywhere, like in hospital parking garages and on the premises. Of course, they're all empty, man. So, like I said, why all these lockdowns and shelters in place, the social distancing protocols that are going on right now, quarantines, governors telling folks not to come into their state unless it's absolutely necessary, and if you do, then you need to quarantine yourself. In some areas of the country, they're actually going door to door looking for folks who are actually coming from the hotbed areas, like those from New York, so on and so forth. So, like I said, if things are really so hyperinflated, if everything's really so exaggerated, and this whole thing is being drummed up, basically, okay, what's the reasoning behind it? Okay, is there some kind of hidden agendas that are actually being slid through that the public is now accepting, and in which we would normally not accept otherwise? That's a very good question to be asking right now at this point. So, who knows? Maybe I'll make another video getting into that aspect of it, of course. So obviously, I just wanted to show how the numbers are highly inflated. And peace out. Happy trails.